Good afternoon and welcome. My name is Paul Rothman. I'm the Dean of the Medical Faculty and the CEO here at Johns Hopkins Medicine. It's my privilege to welcome you today on this very memorable occasion. You should be incredibly proud of yourselves. You've succeeded in one of the country's best and most rigorous programs, a true testament of your hard work, resilience, and talent. I could have said this for many years, but this year it's especially true. Over the past 14 months, COVID-19 has thrown the world into disarray. All of you who are graduating today have shown great flexibility and dedication in dealing with this extraordinary situation. Despite the interruptions and changes that the pandemic has brought, you have persevered and completed your training. Congratulations. I also want to acknowledge the family and friends who've supported you in innumerable ways over the past year and really through your entire lives. All of you have played a key role in helping our graduates reach this point. So thank you and congratulations. For our new MDs and PhDs, Masters of Art and Masters of Science, these degrees open great possibilities for you. Whether you're moving on to a residency program, a postdoctoral fellowship, a teaching position, a job in industry, or some other professional stepping stone, today marks the beginning of an exciting new chapter. For graduating medical students, I know you would touch the lives of many patients through your compassionate care. For the graduating PhDs, I know you will unravel complex and important questions that will help us better understand science and the mysteries of the body. As I consider this moment, I'm going to take a step back, maybe actually 2 steps back. Let's go back over 100 years to 1918. That was the time of another deadly virus ravaged the globe. Over 50 million people died during the influenza pandemic of 1918. And at that time, the world's population was only about a quarter of what it is today. So 50 million people was a great number of people. It was an incredibly difficult time for the public, for patients, and for clinicians. What fascinates me about that event was what happened afterwards. The world was transformed. In 1918, there was no treatment for the disease. There were no tests for the disease. We had very little understanding of the disease itself. We actually didn't know very much about viruses. In fact, initially, flu was thought to be a bacterium and not a virus. At the time, there was no CDC, there was no WHO, there was really no organized system of healthcare. There was no access to physicians for many patients. In addition, many people saw the illness as an individual problem to be solved at the individual level. But the global scale of that catastrophe made it very clear that that approach would not work. The influenza pandemic of 1918 triggered major changes in the world. Many countries developed national healthcare systems after that. The U.S. took a different tack. We have our insurance base, but in fact, even with that, we allowed greater access to healthcare for many, many people, both in the United States and throughout the world. Today, it's a century later, our healthcare system is not flawless here or in other places of the world, and we see that taking its ravages today. But it certainly was a lot better than it was in 1918. The 1918 pandemic also spurred scientists to focus more on tracking patterns of disease to better understand them and to control outbreaks. It stimulated a great deal of research into viruses and vaccines. As in the case of much science, it just takes a long time for science to play out and to lead to treatments and cures. There wasn't actually a flu vaccine that was widely used until the 1940s. It just took that long to understand how vaccines work and to produce them at mass scale. Now let's take a leap forward, not from 1918, but let's go to the early 1980s. That's when I began as a physician, to a different virus that ravaged the world. I graduated and entered internship in 1984. At that time, the New York City, San Francisco, and many major cities were ravaged by a different virus, and that was HIV that caused AIDS. It had a lot of similarities to 1918. Initially we didn't even know it was a virus that caused AIDS. And when we did, we had almost no tools to diagnose it. It was smaller than the 1918 pandemic, but it ravaged communities, and it was a very difficult experience. It was difficult for patients and for their loved ones, but it was also very hard on those physicians and clinicians, nurses who were treating these patients because we felt helpless. As a doctor, you want to help people, and that's why you go into the profession. But in the early 1980s, there was just almost nothing we could do to watch these many very young people die. But just as it had done 6 decades earlier, the pandemic triggered monumental social and medical changes. When AIDS first appeared, there was an enormous stigma attached to it, both here and around the world. In this country, it was seen as a disease of gay men. In part because of this, the U.S. government and pharmaceutical companies gave the disease little attention and funding. Frustrated by this inaction, the gay community responded. Gay activists organized protests demanding more resources, more respect, and a voice in policies related to research and treatment. One of the key leaders of this movement was the author and activist Larry Kramer. He founded both the Gay Men's Health Crisis and the AIDS Coalition to Unleash Power, better known as ACT UP. Kramer's activism grew out of his sense of injustice, but it also came from his desire to help people like himself who were sick with the disease. Here's what he had to say about what motivated him to take action. He said, "It was very scary to have death threat living over your head. Activism is very sustaining. But I don't view myself as a political person. I'm just someone who desperately wants to stay alive." The AIDS activism of Kramer and many others triggered changes. Research and funding for HIV ramped up significantly. The process of testing and improving medicines was streamlined, so the drugs could get to patients much more quickly. And patients became a larger part of the discussion and conversation about how to study and treat AIDS. And these changes spread far beyond this particular disease and helped transform the entire research landscape. It's also important to mention that AIDS activism has done a long way to reduce long-standing prejudice against the LGBTQ community. The AIDS epidemic triggered other crucial changes too. Many experts say it played a key role in the spread of the idea of global health. For example, since 2003, the U.S. has spent more than $90 billion to address the global AIDS crisis. Much of that has gone to fund antiretroviral treatments for patients in the developing world. In 2005, only 2 million people worldwide were receiving therapy. Last year, that has grown to over 25 million people. Clearly, as we've seen over the past 15 months, global health is an idea and a strategy that has not been perfected yet. But I think it's fair to say that the road's a lot farther along than it was 20 or 30 years ago. The AIDS pandemic has also led to enormous progress in many areas of science and medicine. At the beginning of the pandemic, a positive HIV test was a death sentence. That's no longer true. With antiviral treatment, HIV has become a chronic disease, difficult, but usually not fatal. We also have a much better understanding how to prevent HIV transmission, both medically and from a social standpoint. So what do these prior pandemics have to do with today? More precisely, what do they have to do with you and your graduation? We're in the midst of another pandemic. In the U.S., it seems to be, a little bit easing. There are only about 700 deaths a day right now, but there's still more than 20,000 a month. That's still an awful lot of people. And the pandemic is raging around the world. As I tape this today, India and Brazil have huge outbreaks. And so far, less than 4% of the world's population has been vaccinated, so this is far from over. As it continues, this pandemic has already brought monumentous medical and scientific and social change. For example, we've seen an explosion in telemedicine. change that I don't think is going to go away anytime soon. In addition, Gallup poll found that more than half of U.S. workers are now working remotely. I think that's another phenomenon that's here to stay at some level. I think that's going to affect how we design offices, but also has effects on inequality in the future of the cities. So we'll have tremendous changes in our society. COVID has also helped to highlight the longstanding issue our country has with healthcare inequality. Black and other people of color are significantly more likely than others to be infected by the virus and to die from it. But these problems are apparent in almost every other area of healthcare, from cancer rates to life expectancy. The pandemic has just played a crucial role in amplifying and highlighting these urgent issues. And of course, over these 15 months, there's been tremendous breakthroughs in research. For 3 decades, research had started to develop the technology and the understanding to develop mRNA vaccines. And this pandemic has demonstrated how important and essential that technology is. Pfizer and Moderna, those vaccines took less than a year to develop, which is an amazing scientific feat. But I don't want to suggest in any way that this chapter is finished. I actually think this pandemic will continue to change our profession, our country, our world for decades to come. This is where you come in. This is your pandemic. This is your moment. You're the ones who bring these monumentous, as yet unrealized changes into being. You're now embarking on a new phase in your career and your life. As you journey into the world, you'll be the ones to make your patients' lives better. You'll be the ones to make the discoveries and develop the innovations that will help thousands or millions of people. You'll be the ones who accomplish the next great deeds in science and medicine. You may end up focusing on COVID or precision medicine or cancer or social determinants of health, or one of many, many hundreds of other possibilities. You could focus on AIDS or influenza. There are so many opportunities. But wherever you focus your energies, I hope you'll think big and work to bring positive social change or increase opportunities for those without it, or help people here and all over the world to live longer and healthier lives. Or you can do all of these things at once. With this degree, you're now part of an extraordinary group, a long tradition of excellence extending back more than a century. I couldn't be more excited to see what all of you will accomplish in your careers. I have no doubt you'll seize this amazing opportunity. Congratulations. This is a very, very special graduation for me. It is my 13th as dean, but this one's really special for many reasons. So congratulations to all of you and good luck with your careers.